Southwark and Lambeth has a total population of 613,000 people, of which 48,000 are aged 65 or over. Half have a limiting long-term illness, 1,200 live in care homes, and account for over 700 A&E attendances a week. So although older people make up 8% of the population across the two boroughs, in comparison to the UK average of 17%, they still have a high level of need. This level of need will rise as life expectancy increases.
At a time where we've got an ageing population, we know we're probably not doing as much as we can do for our elderly and our older patients. It's really important that we start to think about how we can make care more joined up and more coordinated and make the experience for the individual and the citizen much better than it is now.
We also need to get away from lots of different individual pathways, so diabetes versus heart versus respiratory, and actually see people as a whole.
You get the GPs doing one thing, you get the district nurses doing something else, you get social services doing something else.
In 2012, the hospitals, GPs, social services, commissioners and people of Southwark and Lambeth came together to help local people lead healthier and happier lives. Southwark and Lambeth Integrated Care is the partnership that brings them all together.
So with integrated care, there's an opportunity for us to do more in the community and avoid patients having to go into hospital unnecessarily.
And it's about empowering people and treating each person as a person rather than a patient.
Care for the elderly properly, in comfort, let them have their own life, tender loving care and give them their dignity.
The partnership is developing a variety of projects to resolve the challenges currently faced by health and social care.
Please come in.
Thank you. So holistic assessment is a top-to-toe MOT for anybody who's over 65. It can take place in the GP surgery or go and see patients at home. It's a clinical assessment, so we do their blood pressure, we look at their feet, we ask them how their eyesight is, but we also ask them how they're feeling and gradually draw a picture of what their life is like.
What can we do to help?
Well, I need advice how to get up.
If things come up that need a little bit more delving into, integrated care manager like myself will get involved with the person and be creative, look into that person's problems that they might be having.
So what we'll do is I'll contact the physiotherapist and maybe the occupational therapist as well.
And I think it really makes an impact on keeping people safe at home, independent in what they want to do, not what we want them to do, but listening to how they want to spend their life.
A community multidisciplinary team is a group of professionals, and that includes general practice professionals and primary care professionals, so that might be practice nurses, general practitioners. It involves specialists from the hospital, so we have a geriatrician attend. It involves allied specialities such as speech and language therapists, physiotherapists, as well as social care professionals, district nurses, and really any professional that's working around the patient in the community. We're able to coordinate care in a really joined up way around people.
What we have a team we call the Rapid Response Team, which is a mixture of clinicians and non-clinicians working together who can respond rapidly to the need of the patient. So one of the benefits for me as a GP is the geriatrician hotline, which now affords me the opportunity to be able to get prompt advice from my colleagues in hospital about elderly patients.
One of the key benefits that we've seen is that people are coming to the classes, they're really recognising the improvements in their strength and balance, and that's having that knock-on effect in terms of their confidence with getting out and about and accessing the community, and that's why they keep coming back.
Come all the way back. We start with a warm-up, and then after that we go through our exercises.
Excellent, well done.
To come to a class like this to stop you from falling, and if you are unfortunate and you do fall over, they're teaching you how to get up. I'm always wary of falling. When I'm in the garden, I can hesitate, but lately I can do it. You're not having to rely on other people. You try and work things out for yourself. It does give you that independence of that you're looking after yourself.
If integrated care is to work in Southwark and Lambeth, we must develop it with the people of Southwark and Lambeth.
So it's really important that we work with citizens at all levels in terms of planning their own services as individuals, but also in the design of services as a whole system. So we have service users, carers, citizens in the room with us.
Let's open the door, let's open the way for a closer community, which brings us all together.
So what will integrated care look like for the people of Southwark and Lambeth?
So if we get integrated care right, our patients will live longer, healthier lives, independent, living in their own environment.
You want to make a difference, you want to make a positive impact, and you've enhanced somebody's life.
Let them join together.